Foods to avoid while taking amlodipine. While there aren't specific foods that must be avoided when taking amlodipine, there are some dietary considerations that can help optimize its effectiveness and minimize potential side effects. Foods high in fat can slow down the emptying of the stomach and thus delay the absorption of drugs into the bloodstream. 1. Grapefruit juice can heighten the side effects when taken with amlodipine due to its interaction with the medication's metabolism. Grapefruit contains compounds that inhibit an enzyme called CYP3A4, which plays a crucial role in breaking down amlodipine in the body. When this enzyme is inhibited by grapefruit juice, it can lead to increased levels of amlodipine in the bloodstream. This higher concentration of the medication may intensify its effects and potentially result in adverse reactions or side effects. 2. Potassium-rich foods. While there's no direct interaction between amlodipine and potassium-rich foods, some people on amlodipine may also be taking medications like potassium-sparing diuretics. In such cases, it's essential to moderate intake of high-potassium foods like bananas, oranges, tomatoes, and leafy greens to prevent hyperkalemia, high potassium levels. 3. Eating high-sodium foods while taking amlodipine can potentially counteract the medication's effectiveness in lowering blood pressure and managing cardiovascular health. 4. Drinking alcohol. When alcohol is consumed while taking amlodipine, there can be direct consequences due to the interaction between the two. The combination of amlodipine and alcohol may have additive effects in lowering blood pressure. This can lead to several potential side effects, including tiredness, dizziness, fatigue, drowsiness, upset stomach, nausea, palpitations and flushing of the skin. Alcohol itself can also increase blood pressure, which may counteract the intended effects of amlodipine in treating high blood pressure. To ensure your safety and minimize any potential risks or adverse reactions, it is advisable to limit alcohol consumption or avoid it altogether while taking amlodipine. 5. Caffeine itself is not inherently dangerous for those taking amlodipine, but there are reasons why caution may be warranted when combining the two. Blood pressure effects. Caffeine is a stimulant that can temporarily increase blood pressure by stimulating the release of adrenaline and causing blood vessels to constrict. Amlodipine, on the other hand, works to lower blood pressure by relaxing blood vessels. Combining caffeine with amlodipine may potentially counteract the blood pressure-lowering effects of the medication, making it more difficult to achieve optimal blood pressure control. Increased heart rate. Caffeine can also increase heart rate, which may be problematic for individuals with certain cardiovascular conditions. While amlodipine primarily affects blood vessels, it may also have a mild effect on heart rate. Potential side effects. Both caffeine and amlodipine can cause side effects such as dizziness, lightheadedness, and palpitations. Combining the two may increase the risk of experiencing these side effects, particularly in individuals who are sensitive to caffeine or who have underlying cardiovascular conditions. Interactions with other medications. Some individuals taking amlodipine may also be prescribed other medications that interact with caffeine or affect blood pressure and heart rate. It's essential to consider potential interactions between caffeine and all medications being taken concurrently. If you have concerns about any of the above subjects treated on this platform, we advise you seek advice from your medical practitioner.